Welcome to This Week in Hearing. Hello, I'm Bob Trader, your host for this episode. And today we're going to talk about some interesting innovations at Shoebox. My guest today is Angela Morris from Shoebox, who is an account manager and partnership liaison with these people at this point in time. And many of you may know Angela from some of her other roles in audiology. Thanks for being with us today, Angela. It's my pleasure to be with you and interacting over a topic as well that's an industry thing, as well as a kind of an audiology marketing innovation.
Yes, thank you so much for having me. I appreciate the time.
Well, in case some of you don't know Dr. Morris, Angela has been an audiologist since 1999, working in clinics, hospitals, and a private practice setting before moving to this industry side. And after selling her practice in southeastern Kentucky, she joined Shoebox as an account manager and partnership liaison, bringing experience from her previous role as regional sales manager for Widex. Angela has held leadership roles in our profession. She is the past president of both the Kentucky Academy of Audiology and the Academy of Doctors of Audiology, and has served on the Kentucky Audiology and Speech Licensing Board, and now resides in Northern Kentucky. And again, it's my pleasure to be with you. And, I guess my first question here, Angela, is even though you had a very successful practice, you were a rising star on the professional association group, as well as in audiology practice. What caused you to kind of move again over to the dark side in industry?
Well, that's a good question. So, yes, I had my practice, loved it. My husband decided to take a new role in a new state in Illinois, actually. And so at that time, I sold my practice to one of my audiologists. And that was the year I was actually president of ADA. So I was pretty busy doing all the work for them at that time. So after that was over, though, I had to figure out what I wanted to do when I grew up. And so I decided I would try the industry side. So that's what led me to Widex. And then another move back to Kentucky for my husband's job. And I hope we're where we're going to stay now. So we're all good. But that led me to Shoebox. I kind of took a break for about a year with that move. And I was just very blessed to have this opportunity with Shoebox. It was working with someone that I knew and respected, and I feel like I really could stand behind the solutions that Shoebox has, because with my experience in private practice, I feel like that I had a little bit of knowledge to share on expanding practices and growing services, making practices more efficient. And I do feel like the Shoebox solutions can provide that for them.
Wow. I've always been in awe of our predecessors, guys like Jerry Northern and some of the other colleagues that allowed us to kind of move to the dark side and then kind of come back and then
Sure.
kind of go back, maybe back and forth. I thoroughly enjoyed my time at Bernafon and doing some international things for them, and so I totally understand how a person would go from a very successful practice
Mm-hmm.
and very successful career over to the dark side. Maybe they'll come back and see us a little bit on the other side, as many of us have done.
Right.
Well, I know today we're talking about the shoebox, use of the shoebox products in kind of a new way. Can you give us an idea of how that works? And someone with your background in practice and in the profession, you're the ideal person, from what I can tell, to actually present this kind of a concept for the shoebox people.
Sure. So today we're kind of talking about our quick test solution and how that can work with primary care offices. And I feel like it's a great opportunity for primary care to use hearing screenings in their workflow, because first of all, primary care sees a wide variety of patients for many reasons. I do also feel like that most people don't realize they have a hearing loss. They go to a physician, and if they don't bring it up in their annual exams or any, or if they went for an eye problem or a cold or whatever, they usually don't bring up hearing. It's really, they think that everybody else has a problem. They're mumbling, or they, don't talk loud enough, or those kinds of
Of
things.
course.
So for those reasons, having a screening at the primary care allows that primary care physician not only to provide a more comprehensive evaluation for their patient, especially at those annual exams, but it also allows the patient to get some education about their hearing health that they probably would have not otherwise got. So with our quick test solution, this is a great opportunity for us to work and build those physician relationships as audiology clinics or hearing care clinics, and provide that relationship with them for the benefit of not only the hearing care provider clinic, but for the physician and the patient.
So now by primary care, you're referring to general physicians as well as family practice and some of those kinds of clinics. Okay.
Yes, I think
Well,
any of
and
those.
now, so do you think these screenings should really be part of a general primary care workflow? And
I
how would
do.
that, well, and sorry, how would that work? I mean, and possibly maybe mention something with your background about whether it requires a license to actually do that test and that kind of stuff.
Yeah. So, yes, I do think, like I said, it's a great opportunity there, because I think people go for a variety of reasons. So, for that instance, they're at that particular physician probably more than they're at like a specialist office or some other entity. So, it's the perfect place to lay that groundwork and to have that opportunity to capture them. And I think as far as who can do the testing, with our quick test, it is a screener. It can work very seamlessly into their flow, because, there's some reasons why primary care may not do hearing screenings. And I think a couple of key factors there are time and reimbursement. I think all providers want to do what's best for their patients. But again, if patients are coming in and they're not talking about hearing loss, they don't think they have a problem, they're not bringing it up. So at that point, there's not a reason to screen for it. So by allowing a way to put this seamlessly into their workflow, it allows that benefit for all. So again, time and reimbursement are going to be key factors. I do think also the lack of knowing who to refer to. If audiologists are not going out and trying to build these physician relationships, a physician's not going to do something if they don't have an outcome or a place to refer to, right? So if they find out they had a reduced hearing loss or they do have an issue, what then? So as a audiologist or as a provider, we need to say, this is the path, this is the referral path, and we need to lay a plan for them that, again, is not going to cost them any more time, and they're not going to have to worry about any reimbursements. So again, with this, if they don't have that plan, they're just going to refer to those places they hear. They're not going to research out, let's see, if a person comes to me for hearing loss, who can I send them to? They're not going to take the time to research what all offices are around them. They're going to send them to those national chains that they hear about on TV or that are just out in social media, right? So this is a great way for them to do it. Now, again, back to who can do the test. It's a screener. So when they provide this, the way I see kind of the workflow for this, the quick test is a quick 2-minute screening test that the patient can do while they're waiting for that physician to come in the room. So when the assistant pulls them out of the waiting room and says, okay, Mr. Smith, it's your time. We're going to come back to room number 2. What brings you in today? They talk about that, probably not hearing. They're not going to say that. So they go through all of their routine. At the end of it, they'll say, okay, Dr. So-and-so will be in here to see you in a few moments. While you're waiting, we would like for you to take this hearing screening. So again, they hand them this. It's a self-driven screening by the patient. So they can take it, they can do the screening. So again, key parts, there's no extra time invested on the physician side. So that's a win-win there. For the patient, it's kind of a win because it gives them something to do while they're waiting on the doctor, because very seldomly is that wait just 2 minutes. Probably
Absolutely. That's
longer.
right.
If they're like me, I'm like scanning the room, trying to figure out what all the little things do and what they're going to poke me with next or whatever. So it's kind of nice to have that. But this allows that physician, again, to document those results and to make recommendations for their result without having to do anything extra on their time. They don't have to actually fill out any paperwork or don't have to actually send a referral over or anything like that.
So it's a relatively simple thing, and it can be done easily, even part of diabetic screening or whatever else the
Absolutely.
physician feels is necessary.
Mm-hmm.
And now this is still the tablet-based kind of a screening device, and so so in terms of the way it integrates, we're going to give it to patients before the physician comes in, use that time, and they probably get done with it, as you said, a whole lot sooner than the physician's going to get
Right.
in there to talk to them. And of course, we all know why those things happen, because somebody needs you on the phone, somebody needs you over here, somebody just walked in, on and on and on. So
Sure.
they are under similar pressures to what practitioners are.
Yep.
And, so now, in terms of the primary care providers, what kind of value does that offer them? I mean, my guess is some of it is they find a place to go, as you've suggested, for hearing kinds of things. So maybe we talk about what happens. Well, what's in it for the professional, the
Mm-hmm.
primary care provider, and what's in it for the practitioner that's kind of interacting with them to begin the process in their clinic.
Yeah, absolutely. So again, for the primary care physician, I think that again, having the ability to do that more comprehensive evaluation, it just gives them more information about their patient as a whole. So when they're doing those annual routine screenings, it's nice to be able to add that in. Again, there's no charge to the physician in the suggested use that we're talking about, like with this. So again, when we talked about time and reimbursement being an issue or a lack of a reason why they would do it, it kind of takes that out of the equation, which is nice. No additional time factor in their workflow, and there's no cost to them to provide this for their patients. And again, having that referral pathway set up, again, it's so important for the hearing care professional who will be providing this tool to build that trust and relationship, because again, that physician needs to understand and know that their patients are going to be cared for and they're going to be followed up with the result that they got. So that's really important. And on the hearing care professional side, again, building those relationships are key. And when I had my practice, mine was, I'll go out to the physician's office and I'll take some articles on comorbidities with hearing loss and different things like that to try to get their interest. Who knows if they ever read them, because very rarely did I make it past the front desk.
Well, there's always that person that you
Yeah.
have to, I mean, and that's a person that's a screener, and they're
Yeah,
out to try to keep us from seeing the physician.
exactly.
We don't want you in here. And that person is extremely important in these
They
places.
are good.
It isn't so much get the physician, because they'd probably be real excited about what we're doing, but you have to convince that hardcore person at the front desk or
Exactly.
behind the front desk
Mhm.
that you're so important that you've got to talk with the physician somehow.
Right.
Correct?
So with that, we did that, maybe send a few treats for the staff, and you're basically just trying to get them to remember you. And again, another key factor is that when patients come in, remember, they're not really bringing up hearing loss for the most part, unless there's a sudden hearing loss and that's the reason for being there. Probably hearing loss is not even brought up, because again, the patients aren't bringing it up, the physicians aren't really asking. So you have all of that going on, and it worked for maybe a week or two. You would be in the top of mind, and then they would do it, and then it kind of dwindled off, and then of course you'd have to go back again. So that was constantly, with this particular method, using the quick test that we have, it is such a good flow. Again, it flows seamlessly into the physician's workflow, but for the actual hearing care provider, The quick test offers a portal. So every patient that physician sees that takes this test, the information for their testing, that data is going into a portal that the hearing care provider has access to. So at this point, when they're taking it, their team can now look at all of these hearing results. If they're normal, I mean, I'm all about keeping your patients your patients. So if you're normal, I would highly suggest that they say, hey, Miss Smith, you've had a hearing test or a hearing screen at Dr. So-and-so's office. We see you have normal. That's fantastic. This is your opportunity to provide them with education on what to do next. A yearly hearing evaluation, if that's your plan. But to give them a plan moving forward, you want them, if they do start experiencing hearing loss, to come back to you. Or if they have friends that they encounter that have hearing loss or mention it, you want them to refer them to you. So by having your team contact people in the portal, no matter what the result is for normal hearing, those are going to bring people into your office probably at a later time, but it'll bring them back to your office. If they do show a reduced loss on that screening, this is the time you'll say, okay, Mr. Smith, you had a hearing screening at Dr. So-and-so's office, and we saw you had a reduced loss. We would like to schedule you for a full evaluation so we can further evaluate your hearing and see, how we can help. So this is, again, your team's ability to then turn these patients into, these referrals. And again, that doctor didn't have to do a thing. They didn't have to send fax over a referral. They didn't have to do anything. It just automatically comes from taking it. So again, the time factor for the physician is a no-brainer. And then you have all of this data for your team to be able to bring patients in your door and hopefully turn them into treatment, and which is what you're, looking for. You're looking to try to help those people who have hearing loss. That's our goal.
This almost brings the physician marketing to another level, right?
Exactly.
Before you're walking in with the papers that they never read, you got to get through that screening woman or guy or whoever it is.
Yeah.
You almost beat them over the head to get in there. This kind of offers a new procedure to make that particular primary care physician kind of stand out a little bit, which gives them some differentiation for their practice as well. And how cool is that, not only for them, but for the audiology person, that builds a real relationship with that family practitioner. So now, okay, so this is all cool and this is great, but now how do you become involved with this with the Shoebox people? Now, do I buy every one of the tablets and pay some sort of a fee or whatever to get this set up for the physicians in my city? How do I go about doing that?
That's what I would suggest. I mean, yes, Shoebox is something that we can provide this tool for you. In this scenario, we are suggesting that the hearing care provider is the one who purchases this tool and provides it to the physician, because again, the hearing care provider is the one who has control of that database. They're the ones who want that database because they're looking for, if you want to call it lead generation, referral, however you want to do it, they're looking to get more patients in their door in the audiology practice. That's what they want. And again, the more patients they can see, the more patients they can help. And again, if you're in audiology or a hearing care provider, that is your goal, is to help people with hearing loss. That's always been what we wanted to do. So yes, you would purchase that and then provide that. It is just such a phenomenal way to get these referrals that it makes it a no-brainer. It's almost cost neutral if it pays for itself in no time kind of situation.
It's a new and different. It's a way to differentiate your audiology practice, as well as for the primary care provider to differentiate their practice. And both the practices look like they're just one little rung ahead of the dude up the street, that kind of thing. So
absolutely, definitely makes you stand apart. And again, like I said, if you're not going to do it, somebody's going to do it. Competition, if I had advice to give to someone, I would say go for it, because if you don't do it, someone else is. Competition out there now is just growing all the time. And we know that patients listen to their doctors. I remember doing full comprehensive evals, and you're explaining every last little detail very thoroughly. I felt like I was doing, and they would still well, let me talk to my doctor. It's like, well,
the market track has said people are 8 times more likely to purchase products if indeed their physician sends them to you. So,
Absolutely.
so that's kind of the kind of advantage that the practitioner is going to have, the audiology practice will have. And on the
Absolutely.
physician side, they're doing more in terms of screening for, because hearing loss has a lot of interactions anymore with the dementia connection as well as the diabetic connection and some other
Hmm.
connections that are comorbidities as well. So and so now the next question, I know we don't want to talk cost, specific costs, but is this a uh, from a practitioner's point of view, where both of us come from, is this an expensive marketing thing, or is it kind of a relatively low cost one, considering the benefits that both practices may obtain?
Sure. Um, Yes, and I look at this as a marketing tool. I don't look at it as a piece of equipment like an audiometer or something like that.
Yeah.
Marketing has you should, in my opinion, have a monthly marketing budget. So marketing is not something you pay for one time and it's for life. Back in the day when we did newspaper ads, that you didn't buy one, you get one for life, right?
Well,
So
I also remember the time when we did yellow book ads, believe it or not.
yes,
So
yeah,
I
yeah,
totally get
I
your
have
friend.
those too.
Oh, did you good?
Yeah. So, but those are ongoing costs. So this is something that is an ongoing cost. We are a subscription based company. I put that out there. I think it is a fantastic opportunity to be able to get things upfront at a lower price, and you're paying the subscription. But again, marketing is a monthly is a monthly cost, and you should have this. And so in your marketing budget, when you can get something for less than $100 a month, and your return on investment on this on for a yearly basis is probably obtained in the first couple of months.
Oh my
It will
goodness.
pay for your whole year.
Yeah.
So
And
again,
if
it's
you can get through that hockey person that
that's
runs the
true.
physician's schedule.
Yeah, they
But
must have been trained at Fort Knox. I'm pretty sure.
of course they were. Fort Benning, maybe too. Could be.
Yeah, right.
So anyway, well, now Angela, understand that you guys at Shoebox have an audiology online course for CEUs in this particular area. Uh, so can you tell us a little bit about that, and what can people expect to learn from that if they tune into the AO course?
Yeah, sure. So on April 22nd, I think it's at noon Eastern time, we have a course, Maximizing Referrals, a collaborative approach to hearing screening and primary care. And if they tune in, we're going to basically talk about identifying the need for working with primary care physicians. We'll discuss key strategies to discuss this option with primary care physicians and or to incorporate this into their routine examinations. Also, how to efficiently identify those patients who need that follow up care, and how to increase those referrals into your audiology clinic.
You know, and I know you were probably suggesting this on when you were on the audiology and professional association side, but one of the things that's always been a problem for me, and I've been in audiology a lot longer than I would like to admit. However, we had all these people kind of way up here somewhere who were always telling us this is what you have to do, this, doing this, and this, and this, and they might not have seen a patient in 20 years.
Right.
Here now, the industry is finally taking advice from long-term practitioners from many different settings that know colleagues from all over the place, that they're taking this advice and saying, okay, oh, you think this is a good idea? Let's take this and work it up the chain to kind of facilitate some of the things that all of us really think so. So manufacturers now, whether it's Shoebox or whether it's Widex or whether whoever it is, because of colleagues like yourself that have been in both places, there and there's a number of us out there now that have done these things,
Mm-hmm.
but they're listening to those individuals and then taking those things kind of up the chain, which I think is good on both sides. It's
Yeah.
good for the patients, it's good for the industry, it's good for the particular manufacturer, and it's fabulous for the patients. So
I totally agree. I was always one of those ones who would try anything once, especially where marketing goes. I love marketing. I feel like it's just, is a key to the success of my practice, I feel like. And I was one of these ones who I would try I've been on the movie theater screens. I've been on the shopping carts. I've been on calendars. I've even gave the local cheerleaders. I had T-shirts made up with my logo on it and gave their mascot on the front and let them throw them out at basketball games and football games. I mean, anything to get your name out there, you do. And I feel like with this, it's just such an easier way
Oh yeah,
to
absolutely.
get those leads in, much more productive. So you live and learn a little bit as you get older, I guess.
Well, and no, I don't necessarily think it's just older. I think it's just you have this. Oh, this didn't work, so I'm not going to do that. Now, where this works, and this works, and this works, and honestly, it's refreshing to see Shoebox listening to colleagues that have been there and
Yeah.
working up different situations to facilitate this. I think this is a great idea, and they have the right person, it sounds like, to run this program. So now,
Thank you.
will you be conducting the actual CEU evaluation CEU thing at AO?
I will.
Good.
Yes.
Well, I think for all of you out there that are This Week in Hearing listeners, I would say that you need to take a look at this particular program. As one who's, we have 2 chapters in our new book with Brian Taylor and I on competition. We have a huge chapter with 4 or 5 authors coming from grassroots on marketing. And this sounds like something we should have had in there as well. So, but today my guest has been Dr. Angela Morris, the account manager and partnership liaison with Shoebox. Thank you very much, Angela, for giving us a little bit of an inkling and a little bit of an orientation to possibly a very new and interesting kind of marketing procedure that Shoebox will be discussing on April 22nd at Audiology Online.
Thank you so much. I appreciate you having me, and just want to say one last thing. If anyone does want any more information on this, they can go to our website at shoebox.md. And if they click on request a quote or any other information, they'll be sent to their appropriate account manager, and they'd love to follow up with them and just walk them through this if they have any other questions.
Super. Well, thank you for being with us today at This Week in Hearing. And this is a very interesting project, and I think we should all make a point to be at this April 22nd AO presentation. Thanks again, Angela, for your participation with us.
Thank you so much.